Hi, I'm Dr. Max Lingenfelter. Welcome to our video on what exactly is a hip replacement. This is what a hip replacement looks like. We are simply taking the old ball and socket, which has been damaged by the arthritis, and giving it a new ball and socket. Between the hard surfaces, we utilize polyethylene, which serves as artificial cartilage and allows friction-free and pain-free motion. I perform all of my hip replacements by the direct interior approach, which means the incision is right where the bikini would go. This is in contrast to traditional posterior hip incisions, which are placed on the buttock. The main benefit of performing direct interior is the lack of muscle disruption, which was previously necessary when performing traditional posterior hip replacement through the buttock. As you can imagine, lots of muscle needs to be released to visualize the hip from the back. This resulted in instability and need for posterior hip precautions, like don't cross your legs, don't bend over, don't sleep on your side. None of these apply with the anterior hip replacement. This is because no muscle is disrupted on approach to the hip from the front. We utilize what's called the direct interior approach. By simply spreading these muscles apart in the front, we access the hip and fix it. And simply by removing the retractors at the end of the case, the muscles come back together like a theater curtain. This results in faster recovery, increased stability, no precautions following surgery, a reduced dislocation rate, a reduced risk of postoperative limp, extremely accurate leg length recreation, a smaller incision, and an overall improved patient satisfaction. One of the main benefits of performing direct interior hip replacement is that the patient is laying in the supine or flat on their back. This is a much more neutral position, which enables leg length calculation and recreation of the normal or native alignment of the hip to a much greater degree. This is in contrast to the posterior approach, which is performed in the lateral position traditionally. Also, during direct interior hip replacement, because the patient is laying in a much more neutral position flat on their back, we have the benefit of live digital fluoroscopy or X-ray. This means we have immediate feedback to the surgeon at every increment of the surgical procedure, ensuring greater accuracy, something that is simply not possible with traditional approaches. Here's an example of us checking the cup position to maximize this patient's range of motion and stability. Here we are checking the trowel components for appropriate leg length and offset to recreate this patient's natural anatomy and make this hip feel as natural as possible. Here we are rotating the trowel to ensure appropriate fit and fill for this patient's femur. Here we are checking the final implants for leg length, offset, and ensuring the perfect position to fit this patient's specific anatomy. There is simply no other way to receive this amount of information during the surgery other than using direct digital X-ray. We routinely perform our hip replacements with AI navigation software or robotics system platforms. Both offer excellent outcomes with tremendous improvements in accuracy and reproducibility. There are additional benefits to both. Your surgeon will select which application will improve your outcomes the most. Here's an example of live digital feedback from our software platform, noting the exact position of the hip replacement, specifically the leg length and offset numbers, which are necessary for the surgeon to make fine-tuned adjustments to perfect this hip replacement for this specific patient. By using these techniques, we can take a hip that looks like this, that has been destroyed by arthritis and trauma on the left, and turn it into something like this on the right that is well balanced and restore the native natural motion of the hip. At the conclusion of the operation, the field is closed in a multiple layer fashion to make it strong enough to tolerate range of motion immediately following surgery. This is performed by what's called a plastic surgery closure, meaning there are no sutures or staples on the surface of the skin. All sutures are buried underneath the skin and are dissolvable. 98% of patients will never see their sutures at all. It also means that there are no sutures or staples to be removed at your postoperative visit, which results in a much more pleasant experience. The skin is then covered with a two-tiered bandage system. First, an adhesive layer is applied directly to the skin. Second, an additional barrier or bandage is applied on top of this. This results in 3 solid layers protecting our surgical site. This bandage, which is placed at the conclusion of the operation, is water resistant and should allow showering immediately following surgery, unless otherwise specified by your surgeon. Following a hip replacement, I would suggest using a directional shower head to help avoid spraying water directly onto the bandage, as this can result in the bandage peeling up around the edges. Alternatively, you can keep it covered with saran wrap or a towel. Should I see drainage on my bandage? You may see some drainage on the bandage. This is normal and not to be concerned about. This is a normal part of the healing process and will be changed at your postoperative visit. These bandages are specifically designed to wick away moisture from the skin and healing environment and trap it in a polymer inside the bandage and keep this environment sterile. If, however, the bandage becomes saturated the entire width of the bandage, or if there is leakage from the bandage, you should notify your care team for a bandage change and direct attention. Please leave your bandage on until being removed by your care team in the clinic. Can I cross my legs after hip surgery? All of those things you've heard, like don't cross your legs, don't bend over, don't sleep on your side, use a raised toilet seat or a high chair, those are all related to posterior hip procedures. None of those apply to anterior hip replacements. You can bend over, you can pick up your keys if you drop them, you can put your socks on and your shoes normally, you can sleep in whatever position you find comfortable. There are no limitations on your range of motion from an anterior hip replacement. I simply tell my patients to use pain as their guide and listen to their body on what it feels comfortable doing during the recovery phase. Patients always ask, what can I do to get ready for surgery? And the answer is prehab. You can go see physical therapy once or twice to learn the exercises, or you can simply begin your own home regimen. Studies show the stronger you are at the beginning of the procedure, the faster and better and the ultimate outcome will be. And by doing these exercises, you will strengthen your core, your hip flexors, and your quad, which are all the muscle groups that will be required to walk confidently following your joint replacement. This can be performed by laying flat on your back and imagine someone's hand is about 2.5 feet in front of your toes and you have to kick their hand with your toes about 60 times. If you can do this 2 or 3 times in a day, and then when that becomes too easy, adding some ankle weights, that way you'll hit the ground running with your recovery from surgery. The second exercise I would consider, which is even more challenging, is the half squat. You simply bend at the knee and go halfway down and come back up. You can hold on to a bar or a chair in front of you if you need for additional support. This will also greatly improve your quadricep strength. Some patients with extreme arthritis simply can't tolerate this motion, in which case you should focus on the first exercise. Many patients ask whether or not they can go home the same day of their surgery. And yes, the majority of patients can go home the same day they've had a hip or knee replacement. Actually, this is about 80 to 90% of patients. The reasons that someone would not be able to go home the same day are summarized below. Age greater than 80, significant cardiac, pulmonary, or renal history, diabetes which demonstrates difficulty for tight blood sugar control like an A1C greater than 7.5, an inability to ambulate and clear the physical therapy evaluation following surgery for discharge. This could be someone who requires a walker or wheelchair prior to surgery, indicating they have increased assistance needs following surgery. Any history of stroke or heart attack within the last 2 years. Any history of a bleeding disorder or anemia would be reasons you would likely need to stay in the hospital overnight for observation. This is a generalized list. This decision should be discussed with your surgeon, your primary care physician, and any specialists that care for your chronic medical conditions. When patients ask how long I need to be off of work for joint replacement, as with most things in medicine, it depends. I do have some self-employed patients with purely desk-type work who have had surgery on a Friday and went back to work on Monday remotely, but I don't personally recommend that. I recommend that if you have a sedentary desk job, taking 3 to 4 weeks is a reasonable timeline, with the understanding that you'll still need Tylenol and ibuprofen during this time with frequent elevation and icing. If you have a job that requires long periods of walking or standing, such as teaching or sales, I would recommend waiting 6 to 8 weeks, as these long periods of standing can be uncomfortable earlier on in the healing process, and you will still want to ice and elevate following work. If you have an extremely physically demanding job like factory work, construction, or police officer, I would recommend taking a full 12 weeks to make sure that you are physically ready. It does usually take 3 full months for the stabilizer muscles around the joint to be fully strengthened and tuned up for this type of work. This has been our video on what is a hip replacement. Thank you for joining. I hope you found it helpful. Please like and share with friends or family who may benefit as well. Please stay tuned for our next video, which will go over the recovery process for hip replacement. As always, thank you for joining and have a nice day.